Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, here to discuss a vital topic that may be quietly affecting millions of people's health: obstructive sleep apnea, or OSA. Today we'll explore what it is, why it happens, and how it can lead to serious health complications if left unaddressed. Joining me is my co-host, Alara Sky, who offers clear insights on natural health approaches.
Thank you, Ethan. Obstructive sleep apnea is something people often dismiss as mere snoring or occasional tiredness, but it carries significant risks. Let's begin by defining OSA and explaining why it can disrupt not only sleep but overall health.
Obstructive sleep apnea occurs when the muscles in your throat relax so much that they block your airway during sleep. This causes pauses in breathing, which drop your oxygen levels. Your brain then forces you to wake up briefly, sometimes just for a split second, to restore proper breathing. That constant interruption prevents you from getting deep, restorative sleep.
Exactly. Estimates suggest nearly 1 billion people worldwide are affected by OSA. Many remain undiagnosed, often because they assume snoring or tiredness is normal. However, if untreated, these constant interruptions in airflow can lead to cardiovascular issues, metabolic problems, and impaired cognitive function.
One of the biggest red flags is loud snoring, especially when combined with gasping or choking sounds. Some people also wake up with headaches or experience a dry mouth. Since OSA fragments your sleep cycle, daytime fatigue and difficulty concentrating can become chronic. Mood changes and irritability are common too.
Yes, and if you frequently feel exhausted without a clear reason, it's worth exploring whether OSA might be the cause. Factors that increase the risk include being older, carrying excess tissue in your throat, having structural airway issues, or living with hormonal imbalances. Even vitamin D deficiency has been linked to poor sleep regulation, adding another layer to the puzzle.
That's an important point. We'll explore vitamin D in depth soon, but for now, let's walk through the main risk factors for obstructive sleep apnea. Men are more likely to develop sleep apnea at a younger age, while women see increased risk after menopause. Overly relaxed throat muscles, often due to aging or certain substances, can collapse more easily and block the airway.
Absolutely. Anatomical features can also contribute. If you have a naturally narrow airway, enlarged tonsils, or a small jaw, those structures can restrict airflow. Excess weight around the neck is another critical factor, and smoking or heavy alcohol use can worsen airway obstruction because of inflammation and weakened muscle tone.
There's also a link between certain health conditions and OSA. Heart and kidney disease can lead to fluid retention in the neck, blocking airflow. Hormonal disorders like hypothyroidism or polycystic ovary syndrome can affect airway muscles too. And if you have a family history of OSA, your chances of developing it are higher.
This wide range of influences makes obstructive sleep apnea more prevalent than people realize. Let's pivot to the role vitamin D plays in sleep regulation. Research indicates that vitamin D is crucial for healthy sleep architecture, especially because it helps with the production of acetylcholine, a neurotransmitter important for deep sleep and REM sleep paralysis.
A deficiency in vitamin D can disrupt that process, making it harder to achieve the deep, restorative stages of sleep. Neurologist and sleep coach Dr. Stasha Gomanak has highlighted how low vitamin D affects sleep quality in general, contributing to not just sleep apnea, but insomnia, chronic fatigue, and even morning headaches.
Because the brainstem is loaded with vitamin D receptors, it makes sense that low levels could lead to disrupted sleep patterns. If someone struggles with any sleep disorder, checking vitamin D status is a wise step. Optimizing those levels often yields improvements in overall sleep quality.
Let's talk about what happens if you leave OSA untreated. Chronic interruptions in breathing can strain the cardiovascular system, raising the likelihood of high blood pressure, heart attacks, or strokes. Poorly controlled OSA can also contribute to type 2 diabetes by worsening insulin resistance.
And don't forget cognitive decline. Oxygen deprivation repeated throughout the night affects the brain's ability to function properly. Over time, that can impair memory, attention, and problem-solving skills. Studies even connect severe untreated OSA with an increased risk of dementia.
Precisely. On top of that, a weakened immune system is another threat. Sleep is when your body repairs itself. Constant disruption means your immune function may not get the boost it needs. That can lead to more frequent infections and slower recovery from illnesses.
Daytime sleepiness also puts people at higher risk of accidents, whether at work or behind the wheel. Falling asleep unexpectedly during mundane tasks or feeling too drowsy to drive can lead to serious consequences. Recognizing these risks motivates many people to seek testing and treatment.
The primary conventional treatment is CPAP therapy. It delivers continuous positive airway pressure to keep the throat open. Some individuals find significant symptom relief, but CPAP isn't always comfortable or convenient. The inventor originally intended it as a temporary measure while addressing underlying causes like weight or airway structure.
That's true. Alternatively, some people choose oral appliances known as mandibular advancement devices, which shift the jaw forward to reduce airway collapse. Dentists trained in sleep medicine can customize these devices. Orofacial myofunctional therapy is another promising option, focusing on strengthening the muscles involved in breathing, swallowing, and proper tongue posture.
Yes, orofacial myofunctional therapy, or OMT, helps correct issues like mouth breathing and improper tongue placement. By retraining those muscles, you can alleviate mild to moderate sleep apnea and improve other functions like chewing and swallowing.
In more severe cases, a surgical procedure might be necessary. Surgeons can enlarge the airway by moving the upper and lower jaw forward or removing excess throat tissue. There are also devices that use neuromuscular electrical stimulation to strengthen the tongue and airway muscles when worn daily for short sessions.
That covers the medical side. Now, let's discuss 5 lifestyle modifications that can ease obstructive sleep apnea symptoms. First, it's crucial to optimize your breathing habits. Working with a breathing behavior analyst to identify and correct dysfunctional breathing patterns can make a real difference.
Second, maintaining a healthy weight is essential. Carrying extra pounds around the neck and upper airway can exacerbate or even cause sleep apnea. Losing as little as 10% of your body weight often reduces symptom severity.
Third, sleep position matters. Lying on your back can worsen airway collapse. Sleeping on your side or stomach might help keep the airway open. And some people use pillows or sewn-in tennis balls to prevent rolling onto their backs at night.
Fourth, avoid alcohol and smoking. Alcohol relaxes the throat muscles, increasing the likelihood of airway blockages. Smoking causes airway irritation and fluid retention. Cutting these habits often leads to a noticeable improvement in sleep apnea.
Finally, steer clear of benzodiazepines or sleep aids that relax throat muscles. Talk to your doctor about alternative options. By implementing these lifestyle changes, many people experience fewer breathing interruptions and deeper sleep.
Let's address some frequently asked questions. One common question is, what exactly is obstructive sleep apnea? The short answer, it's a sleep disorder that causes airway blockages, leading to pauses in breathing and reduced oxygen levels. Over time, that can harm cardiovascular, metabolic, and cognitive health.
Another question people ask, how can I know if I have sleep apnea? The telltale signs include loud snoring, gasping for air during sleep, and waking up feeling unrefreshed. Daytime fatigue and headaches can also be clues. Often bed partners notice these patterns first.
Who is more prone to developing OSA? Factors include excess weight, anatomical nuances like a small jaw or enlarged tonsils, hormonal imbalances, and family history. Even if you don't have a classic risk factor, it's worth getting evaluated if you suspect OSA. Lastly, how is OSA treated? CPAP remains the standard, but alternatives include oral appliances, myofunctional therapy, and targeted lifestyle changes. Addressing root causes can provide more sustainable improvements than relying on one method alone.
And that brings us to the end of this episode of Dr. Mercola's Cellular Wisdom. We've covered the definition of obstructive sleep apnea, its risk factors, the essential role of vitamin D, and practical steps for prevention and treatment. Alara, thank you for adding your insights.
Thank you, Ethan. It's crucial for anyone suspecting OSA to understand these points and explore solutions that suit their situation. Proper sleep is foundational to overall health, and recognizing sleep apnea's early signs can truly be life-changing.
Absolutely. We appreciate everyone tuning in. Remember, it's never too late to address sleep apnea and improve your quality of life. Thanks for joining us on Dr. Mercola's Cellular Wisdom. We'll be back soon with more information on strengthening your health from the inside out. Take care.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.